we need results in few days or few weeks, where the person was progressing over years, where we need results in few days. That is also an emergency. So I feel Pottalikalpas have a very important role, not only in emergency management, where we want quick result in malignancies or tumors, where the tumor has to be shrunken very quickly. Otherwise, it might compress the ureter and cause renal failure. So in many such situations, even I feel these the so-called emergency medicines like Pottalis will be of great help. And especially in oncology practice, we definitely need to make the diagnosis as per Ayurveda, the diagnosis principles, etc. We need to follow. And along with Pottalikalpas, giving other medicines also will be very important, so that we'll be able to maintain a constant regression of the disease, especially during COVID time, which opened the scope for Pottalikalpas, where the saturation was 42 and it went up to 91 within 2 hours. Such cases which I had shared previously. And we have documented, very importantly, when we administer some dose of the medicine, it can be either 1 gram per day or 1 gram in a month. The range of these medicines is very huge. So in such situations, many a times, even the Ayurveda fraternity, and of course from the modern fraternity, they are very much afraid about the derangement in liver function test and renal function test. So to convince the scientific fraternity, I have documented in each and every case I treated. I have not presented in every case in the presentation in the PowerPoint, but I have made a point to document in my records of each and every case where deranged LFT has reduced or normalized after starting Rasaushadhis or Pottalikalpas. So the safety of these medicines is proven clinically, which will have a scientific validation. And now we are even making use of nanotechnology to validate the safety, the QC, and safety of this medicine. And we can correlate the dose required. For example, if there is a embryonic cell, uh, renal embryonic cell, we can say what is the dose required to cause toxicity. And at the same time, we can even evaluate for the anti-cancer effect, what is the dose required, which we are working on now, which is actually correlating with the dose what I have given clinically, interestingly. So, and many a times, before I start discussing the cases, we are very much worried, and we are hearing the news about liver injury, etc. This is the news I shared with my Ayurveda friends a few months back, which no one is aware of actually, to defend Ayurveda. When they say Ayurveda medicines are causing liver injury, etc., if we see the statistics, this is the reality where the drugs which are prescribed legally, it can be anti-TB drugs or antibiotics, and number of medicines. These account for reporting of almost 90% of the cases of liver injury. And if you are seeing the very minute number of around 10 to 15% of the cases, it is by traditional medicine, and this is actually not prescribed by a registered practitioner from Ayurveda. It is prescribed by traditional healers, like the so-called traditional healers, quacks, etc. This does not represent Ayurveda. I think this is very important to educate the public and even people from modern medicine side. Many times they take this quackery as a representation of Ayurveda. So giving this data is very important to prove the safety profile of Ayurveda medicines that are being used since many years, and even the safety profile in the last few years gives us a merit to use it in the coming days also. And before I present my case, I would like to give a clarification on what is integrated medicine and cooperative medicine. And in the name of integrated medicine, a lot of confusion has been created. So we have reframed it as cooperative medicine, which actually is very much apt, where modern medicine and Ayurveda doctors cooperate with each other and decide which medicine to be given in to what extent, in which situation, etc. And there is no overlap of the medicines given for the same purpose in the two systems. For example, integrated medicine, I have given an example what people postulate. They're on a set of five medicines in the name of integrated medicine. Ayurveda doctors will go and administer another five medicines. This is going to become mixopathy. So, as per my opinion. So, what is the idea of integrated medicine is there should be cooperation between the two systems. That is, modern medicine doctors should know what Ayurveda has a role in many of the conditions. And at the same time, Ayurveda doctors should be in a position to stop the medicines from modern medicine side. What is not required? And in the right side corner of the lower side of the screen, I've clearly mentioned like uh, how in modern medicine, many of the medicines can be discontinued, some immediately, some gradually. And addition of Ayurveda medicines will benefit patient in a much better way than giving all the medicines together. So this understanding of modern medicine, like which medicine to stop immediately, to stop, taper and stop, which one to continue for some time and then stop, will make a big difference in the success of what Ayurveda medicines we give. So unless we understand this concept, whatever best medicines we give in Ayurveda is not going to give any result. So many a times before I start the medicine, I make sure that patients are aware that they are going to stop the medicine from modern medicine side, and I make sure that they stop it. Once they said that they have stopped these medicines, only then I start Ayurveda medicines. This is an important concept to remember when we're thinking of getting the two systems together. This is a case of multiple myeloma, which was actually progressive on chemotherapy, and he was having further weight loss and the lambda and kappa chains, which is a marker of disease activity or disease progression in spite of chemotherapy. And in this condition, we need quick response. When the disease is rapidly progressing, we need some system in Ayurveda which can quickly halt the process. And at this point of time, Pottalikalpas will be very handy. And in the last 1 year, I have been preparing Potlis on my own. Because of the platform, what I have got to use these medicines, I felt that it is not being prepared in the right way. I took it from individual Vaidyas, pharmacies, etc. But it did not match my requirements. So I started preparing Potlikalpas on my own. And the results, what I'm going to share today, are the modifications which I made to the existing Potlikalpas and many new Potlikalpas which required in my clinical practice. And the results are the outcome of such modifications which I made. And along with the Potlis, I have used other medications also, which I'll be sharing in brief. This case, which was progressive on chemotherapy, after 2 months of Ayurveda treatment, the markers had come down, and after another 2 months to confirm, we had done the bone marrow biopsy. To the left of the screen is a bone marrow biopsy which showed multiple myeloma, and after 6 months of treatment, Ayurveda treatment, the disease is in remission. So in this condition, I used Taragarba Potli. I had made some modification to it, and initially I had used a Jwarahara Potli also, and he had weight loss almost 12 kgs when he came to us, and cough. The all the Kshaya Lakshanas were there, and I had used Abragarba Potli for a period of 15 days. Where he had quick improvement in his general condition. Later on, I followed formulations like Siddhamakar Dhoja, Panchatikta Grita Gokuli, etc. And it was tapered. Initially, the dose was 2 TID, for example, 250 mg. The Kashta Aushadhis, the Rasa Aushadhis, 125 mg, 1 BD, for example. And we had subjected the patient to repeated Shodhana procedures like Basti, Virechana, etc. And after a period of uh, around 6 months, if I'm not wrong, after 5 months of Ayurveda treatment, the bone marrow aspiration showed the disease is in complete remission. And he was a candidate for, he was suggested for bone marrow transplant. And looking at the expense and the risk involved in bone marrow transplant, he came to us for further management. And many a times where we plan palliative care in modern medicine, I'll be showing it in the subsequent cases. With the availability of good medicines from Ayurveda, I feel that we can convert many of the palliative care cases to curative care. It is very much possible. Why I'm telling this is many a times when big hospitals label the disease is not curable or palliative, even many a times I have seen Ayurveda doctors start palliative care. They just keep some rasayana, kashayas, etc., just to keep the patient comfortable. Because the modern medicine doctor has already said that the disease is not curable. I feel even in such situations where the modern medicine field plans palliative care, at least 50 to 60% of the cases, as per our experience of last few years, we can convert them to curative care with good monitoring of the parameters, blood parameters, investigations, etc., close monitoring in a modern medicine setup, and then administering these drugs will be of great help in curing the disease rather than giving palliative care. This is an interesting case where it was a grade 3 diffuse large B cell lymphoma, grade 3 non-Hodgkin's lymphoma, and he was advised R-CHOP regimen, which is a chemotherapy regimen usually planned for non-Hodgkin's lymphoma. And the disease went under remission within 6 months of treatment. Now we got the scan done in the month of July this month. 5th. The disease is still in remission. The patient is doing absolutely fine. He had weight gain of 4 kg, and Basti is being done every 6 months. He is admitted in modern medicine hospital, where in Bangalore we have formed a setup where we can admit and give Ayurveda treatment before surgery, after surgery. If therapy has to be given with close monitoring of the parameters, we get the procedures done. Where in this case, I had used Taragarbha Potli, and the dose is 6 grams, 6 gram per month. And initially it was high, around 12 gram per month, then gradually I reduced. Now he is in a maintenance dose. And as we say that if the disease does not relapse in a period of 2 years after remission, we can say the disease has been cured. Now it is 1.5 year. He is doing absolutely good. The disease is in remission, and I'm continuing other medicines also along with these medicines. And I feel maintaining the quality and consistency of the medicines is very important, which is not possible in the current scenario. So that has made us to prepare the medicine on our own, so we can maintain the result what we have achieved. Because in oncology, getting the result or making the tumor size zero or getting the blood parameters normally is not a big challenge, but maintaining them for over a period of years becomes a big challenge. And in such situations, I feel having guaranteed quality of the medicines is very important. For this, I turned to prepare the medicines on my own. That has given us good result, and I feel that has improved the results by 30 to 40% in my clinical practice in the last 1 year. And many a times, patients come with complications of malignancy. Like this is a case of colon C with liver mets to the left of the screen, what we are seeing. He presented to intensive care unit with encephalopathy. What we say that when the bilirubin increases, it is going to affect the functioning of the brain. For example, when the level reaches, as we know, the level is less than 1 is normal. When the level reaches 5, 10, they will start becoming drowsy and start going into coma when they reach 15. This is a case where present patient went to coma soon after he was going into coma. And this is actually, we say something known as flapping tremors. Flapping tremors are present in carbon dioxide narcosis and hepatic encephalopathy, where because of excess carbon dioxide or excess ammonia, the brain is affected to a very great extent. And that's why we see drowsiness, slurring of speech, tremors, etc. To the left of the video where I'm playing is actually a typical representation of flapping tremors. When I ask the patient, he's not able to hold. The elbow should be extended, wrist joint should be extended, and I'm going to play it again where we are seeing flapping tremors when the bilirubin has reached just 14. And at this point of time, we have to do some procedures to reduce the outflow of bilirubin, maybe stenting of the blocked common bile duct or the liver lesion, etc., which will actually again cause drainage of the bile juice and reduction in bilirubin. So many times we cannot even wait for the procedure. Within few hours, the patient can go into coma. And to the right is a case where one more case had presented with colon CA, with the sigmoid colon operated chemotherapy done with liver mets. And in this case, the entire liver has been replaced by metastasis. So almost he was functioning without liver itself. And the bilirubin level of the patient to the right side, it was 35. And we are able to see when we started Ayurveda treatment, when the bilirubin was 12, 13, has benefited him from and it has benefited him so that he has not gone into encephalopathy even if the bilirubin has crossed 30. It was 34 exactly in this condition. So even in this condition, his general health was very good. The raised bilirubin level has not affected his body. So, and we can wait for some procedures to be done. This is the advantage where Pottalikalpas can protect the brain, where we're waiting for some rescue procedure to be done in oncology practice. Even in this condition, oncology, there are a lot of emergency conditions, as the case I discussed previously, where we need to maintain the health of the body, even though we are waiting for some definitive procedures to be done on a later date. The same patient to the left, I'm showing where who developed encephalopathy. He was going to coma when the bilirubin was 14. Because when we start at that state, they cannot, patients cannot even take the Pottalikalpas, which is given sublingually. They cannot swallow, they can aspirate. And the same patient, I said, the previous patient for whom we started Ayurveda medicine, even bilirubin, where the bilirubin had crossed 30, he was walking. So the quality of life in many conditions can be improved, where we expect the patient to go into coma and then collapse. the quality can be extended for few more days. This is the capacity of what Ayurveda can do. Uh, this is a little difficult to imagine with a bilirubin of 30 plus. Person is walking normally with normal sensorium, with good cognition, etc. And many a times, emergency and cancer can be handled together with a cooperative approach using the Rasaushadis. For example, this is a case of leukemia, acute lymphoblastic leukemia, who was treated at Manipal Hospital in Bangalore. And the disease relapsed. They said the disease is in remission after spending 25 lakhs for chemotherapy. And he was actually a patient of hereditary pancreatitis. And because of the existing pancreatitis, there was a drug by name L-asparginase, which actually caused the worsening of the existing pancreatitis. And after 6 months of completing the initial chemotherapy course, the doctor said the disease is in remission, everything is fine, etc. But unfortunately, after 6 months, the disease relapsed. Along with disease, the tough challenge is the child was having severe pancreatitis. They went to Asian Institute of Gastroenterology, Hyderabad, and he had even colitis. The marker of that fecal calprotectin was 1000. It was more than 1000. Normal range is less than 10. And he had given a lot of supportive care, which did not work. Like when the WBC count, when the disease relapsed, WBC count started falling from 6,000 to 3,000, 2,000. He was given filgrastim, a lot of injections to increase the WBC count. In spite of that, his general condition did not improve. And his relative, who is a hemato-oncologist in Manipal Hospital, he said even if bone marrow transplant is done, he will not survive. And in this situation, he came to a hospice in Bangalore, where I usually visit for end of life care with morphine patch. And even with morphine patch, he did not sleep, he did not eat even a single food, single spoon of food or water, sip of water, because of fear of pain getting aggravated due to pancreatitis. So he was not taking any food for 15 days, and lot of pain management was done. All the injections were given, morphine was given. Still, the pain was not under control for 15 days, and which is very much evident from the video. This was his condition. He used to bite his finger with desperation. And his WBC count is 300, platelet is 20,000, hemoglobin is 6. After transfusion, they had got the child here. And he's having fever of 103, 104. So this is a very tricky situation where the person cannot take anything orally. At the same time, we had to do something immediately. We cannot wait the child to become better and then I will give any medicines orally. So at this point of time, Pottalikalpas will come into rescue, where we can initially rescue the patient, make the patient fit to take other medication from Ayurveda side itself. Here, my intervention from modern medicine part, because the child can go into dehydration and acute kidney injury because of reduced urine output. I made a point to hydrate the patient, give IV fluids, and maintain the urine output. It should be adequate for his body weight. I made sure that the input and output is adequate for the child. And not even a single paracetamol tablet was given or any other modern medicines for pain management or fever. And I had given the different Pottalikalpas, our self-prepared Pottalikalpas like Jwarahara Pottali, Lauhagarbha, Pravalagarbha, and Prameha Gajakesari Pottali, which has helped him immensely in this condition. And a combination of Raupya Basma, Hartala Manshila, which I mixed with honey and administered sublingually. And the dose was on a more frequent basis till he had relief, and slowly the dose was tapered, and the patient had complete relief of pain and he started sleeping within 15 minutes of starting this Ayurveda medicines. So why I'm stressing on this point is many a times we feel that there is no pain management in Ayurveda. For pain, we have to take painkillers, etc. There's a lot of misconception and miscommunication happening in Ayurveda fraternity also. This one example shows that the pain which has not been responded even to morphine, the highest pain management medicine in modern medicine. Uh, Even in such situations, we can give significant pain relief within few minutes. And the same kid, after 2 hours, he woke up from sleep and he was able to take Ganji liquid without any pain, without any suffering. This shows the capacity of Ayurveda to handle even emergency conditions, even in critical cases like with existing malignancy, where the pain management has happened and he's taking comfortably without any pain abdomen. And this is a case of pancreatitis worsened because of chemotherapy and the existing leukemia who is on the verge of death. We can see the documentation from 1,490 it became 350 and 320, and he came to Kshema Hospital in Bangalore, where he followed this cooperative model of integration or approach to such critical conditions where hemoglobin was 10.5 after transfusion. He came here and WBC count was 300, platelet was 27,000, and after within a weeks of Ayurveda treatment, WBC count became normal, and we are seeing the platelet also without transfusion it has crossed 90,000 and not given him a single drop of blood. Without any transfusion it has improved, and the person who came for palliative care or to have a comfort death, the child, went back after 25 days by complete remission of the disease. So we are happy to say that this palliative care has been converted to curative care. So within a span of 25 days. So the patient's relatives, mother, sister, grandfather, etc., with my team member, Dr. Bhargav, who was assisting me in those days. Even now, I have an expanded team along with Bhargav, Dr. Bhargav. I have a team of 8 doctors. We are uh, formulating new combinations to tackle such disease. And the bone marrow biopsy of the same patient has shown the disease to be in remission. Even now, the child is doing good. And after I got this bone marrow biopsy, which show the disease is in complete remission, I took the report to the patient's relative, who is a hemato-oncologist in Bangalore, Manipal Hospital, Dr. Mallikarjun Kalshetty. He was surprised to see the result because he was the one who told the patient party that nothing can be done. Please don't get the child to me because he's in a verge of collapse. He was surprised to see that, and he said, "This is difficult for me to even imagine that such outcomes can be possible through Ayurveda." And he said it is unimaginable to see such a response in a case which we have left hope. And once I informed him, he went to his native to attend a function where he met the family members. And we are able to see the child has significantly gained weight from 18 kg to 32 kg within a span of 3 months. Now he is back to his school, he has written the exam. And I'm happy to say that the results have been taken note by the modern medicine doctors, and even they're referring the cases, supporting how this can be done in the framework of ethical and legal framework, how it can be taken forward. And this is one more case who came from our native place. After evaluating in Manipal, they said multiple myeloma, advanced stage, nothing much can be done. And in pediatric and geriatric age, where patients initially they're very much reluctant, they're not strong enough to swallow medicines. It is very difficult to convince them to even swallow because of two reasons: because of the extremes of age, and second reason is we cannot tell them the truth that you have the cancer, that you have to take this. We cannot tell them the seriousness that of the disease, that if you don't take the medicine, you will collapse in 1 week. So when we have such a situation, we need minimalistic approach. I think in this situation, Rasosh, this will be of great help. And she came to case of multiple myeloma. She came to the hospital for palliative care. And the same lady, after 3 months, she's playing cricket with her grandkids. So, and the situation is like it is very much difficult for us to plan palliative care, even in such conditions from modern medicine perspective. Palliative care means we keep the patient under comfort. And at the same time, many times palliative care itself can cause a lot of trouble, which is not the case with Ayurveda. Even in where we plan palliative care in modern medicine, curative care can be given. This is one of the approach, one of the example. And I got the serum electrophoresis done for this patient, which has come, the disease is in remission. And many a times patients come to us, as we are all aware, when patients come for Ayurveda treatment, they have already tried all the modalities of treatment, chemo, radiation, etc. And as we know the concept of drug resistance for antibiotics, similarly, drug resistance will develop even for the medications given like chemotherapy, radiation. And in the end stage, when they come to us, they have developed enormous resistance. So we need to give the best of medicines available in Ayurveda, along with the routine medications, what we usually give in Ayurveda. We need to plan some medicines which can break that resistance and make the tumor more more sensitive to the action of anti-cancer medicines what we give. And I think even in these situations, taking this case as an example, Pottalikalpas can be of great help. And in the previous case, I forgot to say, even in this case, I had used Hema and Taragarbha Pottli along with the Trailaka Chintamani Rasa for a period of 2 months. Then I tapered. Now, even after 1 year, she is doing absolutely fine. And these are self-prepared potlis as per the requirement. I have made the modification. And this is a case where I used Tamragarbha, Malagarbha, and Hemagarbha potli. In a dose of initially, I had used 16 gram per month. So, and I made point to document the LFT before and after treatment also. So, the safety profile of these medicines are very much documented in the long run also. And we are planning for publication of such case series. So, we are systematically documenting the things where the tumor size, lymph node size, comparative PET scan before and after. And this lady was taking six morphine tablets per day, 10 mg, with severe pain. Even with that morphine, her pain was not coming down. And this is a case where it was an operated case of left buccal mucosal carcinoma. After surgery, chemo, radiation, everything was done. The disease relapsed. And once the disease relapsed, they started on chemotherapy radiation. The relapsed tumor size was just 3 centimeter, and after chemo radiation, it worsened to 8 centimeter. And within 1 month of Ayurveda treatment, the tumor reduced from 8 to back to 3. To the right side of the screen, we can see a significant difference in the tumor size, and the ulcerative lesion had scraped off uh, from the angle of the left lip. So, and within within 1 week of starting Ayurveda treatment, the need for morphine had completely stopped. So, how one medicine in Ayurveda can take care of multiple things is a very big advantage, which is actually a big problem for modern medicine. Like in this condition, she was newly diagnosed diabetic. After 1 week of starting chemo, we had to give multiple medication to control pain, blood sugar levels, etc. Where we have a multi-department approach in modern medicine, and we fail in many instances. In such conditions, minimalistic approach in Ayurveda, especially Rasaushadis, can take care of the multiple problems. It will be a big benefit for the patient where they are not in a position to take huge quantity of medicines. And in this context, also I had used Hema, Tamra, and Malagarbha, as I mentioned earlier. We are seeing a significant improvement within a span of 1 month. This was presented by one of Ayurveda student paper presentation, which where we have clearly mentioned the history of the patient, what is the course of the disease, and after starting Ayurveda intervention, what is the outcome. And again, I would like to convey through this platform, through this case, that um, I think we should stop saying that there is no medicine for pain, for immediate relief in Ayurveda, and we should convince even modern medicine doctors and the public that there are more powerful medicines which can manage pain much more effectively without any side effect through Ayurveda. Now, here comes a new chapter of how, as a surgeon, I can make use of this Ayurveda, especially Pottalikalpas, before and after surgery and during surgery. Many a times, patients require surgery immediately, maybe within a week's time, within 15 days, within 1 month, for example. But their condition is so bad that we cannot think of operating them for the next 2 months. Without operating, the disease is going to progress. And I feel when it comes to oncology practice in Ayurveda, it is not only giving Swarna, Rajata, Hiraka and curing the disease. We need to know when to operate the disease, when to not operate the disease. And having the background of Ayurveda, is there any problem of operating the same case? For example, in modern medicine, many a times we decide that if you operate, the condition is going to worsen. There may be metastasis to other areas, etc. So applying the principles of Ayurveda, so I can give some preventive medicines before surgery, so that after surgery, what are the complications can be nullified or minimized, and then do the surgery so that the complications of surgery are minimized, which I'll be discussing through examples. And many a times after surgery, they're put on multiple pain medications, antibiotics, and with this, the recovery will again prolong because of the side effects of antibiotics and painkillers. So now I have come to a situation where I prepare the patient before any surgery to be done, and we assess after the surgery what are the side effects the patients might develop, which we all know. For example, after breast cancer surgery, lymph nodes are removed, radiation is given, for example, then a person develops lymphedema, or after pelvic lymph node dissection, lower limb edema can develop. Other things we all know, like infection, etc., sepsis. These are known complications to all of us. And there are some specific complications to that surgery. So as a preventive medicine, I start the medicines before the procedure is planned, maybe 1 week or 15 days or even 1 month prior. Then surgery is planned. And even during surgery, I follow some principles of Ayurveda and whatever things can be administered during the surgery, inside the body, outside the body, etc. And even after surgery, from day one, we start our Ayurveda protocol. So the need for painkiller is almost nil, and there are no antibiotics used after surgery. Where I use only Ayurveda medicine, even for laparotomy surgeries, where we see a lot of contamination, and I'm able to get the result, keep the patient in a very good condition without the wound getting infected. We are able to do this without the help of antibiotics. This is an example where I had to operate a lady with a thymoma. It is a mass in between the two lungs, which is actually benign mass, sometimes can become malignant. So where her fasting sugar was 555 and HbA1c was 14. So in this condition, doing a major surgery, thoracoscopic removal will be very difficult. I had used Tridhatu Garbha Potli for Tridhatu. I had used Hemagrabha Potli, and within 3 months, the HbA1c reduced from 14 to 8. She had a neuropathy, etc. Many of her symptoms also improved, and she had 4 kg weight gain. Her general condition improved. And after improving her general condition, we took her for a thoracoscopic surgery where through 3 keyholes we were able to remove the tumor. And the benefits of starting medicine before the planned surgery were seen even after the surgery was completed. For example, during the surgery, there will be a lot of adhesion around the tumor. Usually, we require, especially in thymoma surgery, we have to spend 7 to 8 hours removing the adhesions around the critical area, because the area of thymoma is such that it is adherent to some of the layers of the heart and the two lungs, main arteries, etc. So we need to lot of time to dissect the tumor that is very much adherent to these critical areas where I have the risk of damaging some very important critical structures. So giving medicines, especially Pottalikalpas, along with other medicines before surgery, will help us to shrink the tumor, release the adhesion, so the surgery becomes minimal. So instead of planning for a 7-hour surgery, this was over in 3.5 hours, and within 2 days the patient was discharged. The two chest drain tubes were removed, and the post-op recovery was very much uneventful. And again, in this case, I have not given any antibiotic, even though it was a major surgery. This is an interesting case which was sent to me by one of the government hospital in Karnataka, where they went for palliative chemo, but they did not take, because they said even if you give or don't give chemo, there is no change in the outcome of the disease. She will not survive for more than a month's time. This is a case of ulcerative breast cancer with extensive mets to both the lungs, especially left lung. There was a massive pleural effusion. We can see the X-ray where the left lung is almost 3/4 filled up with pleural fluid, which I did the tapping, and she was actually a newly diagnosed diabetic. HbA1c was 10.8. When we admitted her, she was breathless, and after giving the removing the pleural fluid, there is a risk that it will accumulate back again in a few days' time. So prevent that along with the Pushkaramala, Dashamala Kattutraya Kashaya combination, etc. And the Ayurveda approach was Kapha Sthana and Kapha Prakriti. So some sort of we had taken some approaches to reduce the blood sugar levels also. As I said, she was a newly diagnosed diabetic. HbA1c was 10.8. Fasting sugar was around the range of 300, 350. When we had the monitoring for 3 days, it was 300, 350, 300, 350, etc. And once we started Ayurveda medicines, I had prepared a potli by name Prameha Gajakesari Pottali, along with Hema, Tara, and Prameha Gajakesari Pottali, 500 mg per day in a dose, along with other medication. The the monitoring of the sugar levels were actually very much improved. The levels were very much good. It had come to a level of 100, 120, 140, etc. And then we took up for surgery. 3 days we were waiting. We had to wait for 3 days after we started Ayurveda medicine. So general condition is stabilized, and we took her for surgery. And during surgery also, many a times in advanced conditions, we will not be able to remove some of the lymph nodes, which will be adherent to the main vessels. We'll be able to remove majority of the lymph nodes. Some lymph nodes may be left behind, which we cannot remove because of some of the structural addition of the lymph node to the important structures, or some things can be left behind, which is not visible macroscopically. So in these conditions, there are some medicines which we all know in Ayurveda has very good local action. Now we have SS only once the patient comes outside operation theater, we can apply, or if the tumor is hanging outside like a tumor mass, cauliflower growth, we can apply. But if something can be done inside the body, where we know that the tumor is in an aggressive stage, the micromets or the micro uh, stations of lymph nodes, it's difficult to clear them during surgery. If such areas are exposed to this Pottalikalpas along with other medication, as per the case, and how I decide the medicine is depending on what surgery, what organ involvement. Accordingly, I select the Pottalikalpas and other Kastaushadhi also. I make a combination of these Rasaushadhis and Kastaushadhis. And you can see my assistant, he is Dr. Bhargav, MD Kaya Chikitsa, and he is helping me in applying this Pottali, preparing the combination. And we mix it with normal saline, add other medicines what is required. Before, after here the breast is already removed, before I close the incision, we apply that mixture into the surgical cavity so that the tumor, the residual tumor, which is not visible to the naked eye, is taken care of by these Ayurveda medicines, which have effective local action. In this case, I use a combination of Hema and Tamragarbha Potli. I had used almost entire gram of Potli for that one session of administering the fluid, a fluid wash. So this is a picture what we are seeing. If you observe carefully, the tissue is slowly taking up the medicines what we have applied. So, and the tissue absorption happens for a period of minute or two. Then we do the suctioning. And to the right, we are very much able to see that at the top of the right photo that the tissue has slightly turned blackish brown, where the tissue has been has adequately absorbed the medicine what we have mixed with normal saline. So in this way, even during surgery, if we are able to use the Pottalikalpas and the combination of other medicines as per the case, we'll be able to avoid the relapse of the disease. We can contribute to some of the to some extent to avoid the recurrence, and it will complement the medicine what we are giving after the surgery. And as I said, I don't use any betadine for dressing or any other ointments. I use only Ayurveda medicines inside the body and outside the body also. And as I told before, this patient was a diabetic with HbA1c of 10.8. To the left is the patient immediately after surgery. The mastectomy incision is in, and the two drain tubes are placed. And this is the same patient after 2 weeks. He had removed the suture, wound has completely healed without giving any antibiotics, and had continued Prameya Gajikesari Potli for another 2 months. And after 3 months, she had come where the HbA1c was 10.8 has become 7.3. We have almost reversed the diabetes without giving anything special for diabetes itself, like giving metformin, insulin, etc. We have managed her through only Ayurveda. And interestingly, after 3 months, and I would like to share that many a times in metastatic breast cancer, where a tumor in the breast has spread to other organs, it is said that by taking the experience of a research done at Tata Memorial Hospital, it is said that in metastatic breast cancer disease, if surgery is done, the metastatic areas will worsen quickly. So surgery should not be done. So now, taking this principle, I was not supposed to operate on this patient. But having the approach of Ayurveda and the utility of Ayurveda, I could make use of Ayurveda medicines and bypass the roadblocks what we are having in modern medicine. If surgery is done, what happens? So such roadblocks we were able to bypass with the use of Ayurveda, and the results are very much evident in the report what I have shared now. And the gross pleural effusion is still moderate even after 3 months. There was not even a single tapping done. Diabetes is almost reversed, and there was resolution of the mediastinal lymph nodes. And even we are able to see the pleural nodules have completely. There was significant interval decrease in the thickening of the costal pleura. So there is a very good response to the treatment what we had offered in a 3 months time. Instead of the disease progressing, where the oncology department had planned in the government hospital palliative care, we were able to give the treatment in a curative direction. So in this way, what I'm trying to convey through this is managing cancer is very complex. If I have just Potli or just Swarna or Hiraka, the work is not done. We need to know whether surgery has to be done or not. If the surgery has to be done, what are the complications might happen during and after surgery? And to tackle that, many a times modern medicine has no answers. And in such situations, what approach should be there through Ayurveda? I think once we have this holistic idea of what can be done through the two systems, it is very much possible to give such good quality life to many of the patients. And we are actually a quality of life assessment. My friend Dr. Santosh, who is very much seriously documenting all the scoring systems, which will help us to publish in future. And this is the same lady who had come after 3 months for after 3 months of surgery for follow-up, who was offered palliative care. She's able to walk without any oxygen support, and there was no need to tap it even in in a 3 month span. And I feel it is very important for us to, I'm going to wind up in the next 5 minutes. It is very much important to project Ayurveda in such a way that, as of now, again, I'm repeating what I said in the initial part of the presentation, that Ayurveda has been presented in many platforms and even by some of the authorities in the central government who take care of this Ayush research, etc. Ayurveda being medicine or a way which can supplement or improve the or reduce the side effects of chemotherapy radiation. I think along with that, we should even talk about how Ayurveda can play a role when we cannot give chemotherapy radiation, when chemotherapy fails or when radiation fails to contain the growth of the tumor, how Ayurveda can intervene and cause regression of the existing condition. I think it is very much important to discuss of these conditions because whatever good medicines we have, when chemo radiation is given and along with that these medicines are given, it is not going to benefit the patient in any way. This is my experience. So we presented this idea in Taiwan. We represented India in this concept of healthcare in Taiwan. So which has actually drawn global interest. They are interested in our model of cooperative medicine, where the two systems come together and discuss the strength and weakness of each system. And without having any ego, doctors from modern medicine, I have a team now, even my seniors, juniors, etc. We discuss what is the possibility of rescue through our side and at what cost are we giving the result, etc. We balance many things and decide who should be the giving the main treatment in many cases. And as I told earlier, through this presentation, I'm not trying to convey that Ayurveda is superior or modern medicine is inferior or the vice versa. So I feel that if we now we have developed a two lung model where we see that modern medicine and Ayurveda, it's equally important, very much required, and it should go hand in hand without giving the two things together. It should go hand in hand, support each other. As I told, we have to give IV fluids, catheterization, even if it's not modern medicine. Such concepts of modern medicine and Ayurveda, when it bridges in the right interest and in the right mindset, in the right spirit, the patient is going to benefit. The patient is nothing but the heart. If you consider the heart, for example, when one lung dysfunctions or does not function properly, the burden is on the heart and the other lung. Similarly, when one system does not support the ongoing treatment of the other system, the burden will be on the on that existing system and the patient. So similarly, when we have that good understanding and collaboration between the two systems, how we can make use of these existing two systems in our country, which is not possible in other countries, because we have the best of modern medicine and Ayurveda in the world. And if we have that cross connection between the two systems, I think we can become Vishwaguru. There's no doubt in that. Thank you.
Thank you so much, sir, for this wonderful topic. Our audience has been awed by the experience that you have spoken. There are a few questions, sir. I won't be taking much of your time. Sir, one question is you had discussed a case of multiple myeloma. The doctor has asked, like, sir, can you just explain on to the approach and the rationale of using the drugs that you have proposed?
So, as I mentioned earlier, sir, we have a team of Vaidyas. So, where on the perspective of modern medicine, I have involved our senior hemato-oncologist also in our team. And as I said earlier, we are not few people doing this. We are a team of 20 doctors, both from modern medicine and Ayurveda, involved in decision making. And the modern medicine doctors are the ones who have understood the capacity of Ayurveda and who have respect towards Ayurveda. So such people give their sincere opinion, and at this age, either pediatric or geriatric, or the disease has relapsed, whether chemo is going to help or not. So I'll be like a middleman having a discussion between modern medicine and Ayurveda, such experts, and giving the information to Ayurveda people, and they decide, and we take the information not only from microscope and PET scan, etc. And even from Ayurveda way of diagnosis also is very important for us. When we see the pathogenesis, etc., we take into consideration the Ayurveda parameters also. And my team of doctors, Ayurveda doctors, they decide what should be the approach and what is the intensity of the treatment to be given, and if there are any concerning things. For example, if you have six problems now, for example, if there is a lung cancer, the tumor is sitting in the bronchus, if it is invading a blood vessel, I will say them, the patient can anytime spit out blood, he can collapse. There's a big, I can see in a CT scan that it is fed by a very big blood vessel. So I will ask them to add high dose of chandra colors as preventive medicine, for example. So this is my involvement, and exactly how to plan the treatment is done by my team of Vaidyas.
Okay. And sir, with regards to gynecological practice, we are seeing much amount of gynec patients. Like other than breast cancer, there are ovarian cancers which are fast and aggressive.
Correct, sir.
In those cases, sir, what would be your experience that you would like to share?
Yeah, sir, actually, those cancers are very aggressive, and at the same time, they respond
Mm.
very well to Ayurveda treatment also. Not only Ayurveda treatment, in many of the malignancies I've seen which are aggressive, they respond very well to any anti-cancer medicine, either chemo or Ayurveda medicines also. But the only problem is, sir, when they respond very well initially to chemotherapy, they come back in the same speed, with the speed which they went back. There is a problem. So many a times in gynec cancers, I have seen ovarian cancer, they get very good response. The mental meds have gone disappeared, etc. And when we convince them to take Ayurveda treatment, they feel that everything is good. Why should we take now? If the disease is in remission, CA 125 has reduced, for example, why there is a need to take? And I've seen when people follow up with CA 125, the levels have come from 1000 to 20. They say everything is fine, doing good, etc. And suddenly the CA 125 has raised to 10,000. So, and at this point of time, people come
Okay.
to Ayurveda, as we are all aware. And I feel that if you're able to convince, now I've done a lot of over NCA surgeries in the last few months, and we are able to see that before surgery, if you give Ayurveda medicines, there is a good response in shrinking the tumor mass. For example, most of the gynec cancers, which you mentioned, they come with ascites. When there is ascites, we cannot do the surgery. So I admit the patient along with the our Rasa Aushadhis, internal medication. I start them on Nitya Virechana. I reduce the ascites. So when the ascites is reduced and we give medicine for 15-20 days, the addition of the tumor, for example, ovarian mass might be adherent to the ureter or the bladder, etc. It is very difficult to do the surgery because I might harm the bladder. So I can give this Pottalikalpas along with other Kashtaushathis and some Shodhana procedures 15 days, 1 month before the surgery. And I'm planning surgery. I have done surgery in many such cases, and I'm following up 3 months, 6 months. I'm getting very good result when compared to the conventional management. This can be the rough protocol we can follow,
Okay.
sir, as per
And
our
sir,
current experience.
okay. And sir, with regards to the medicines, you have mentioned that you give a permutation combination of different portals. So is it
Yes.
by rubbing patient is having a good palliative care? So is it with regards to any kind of anupan that you suggest or the time that when we give this medicine?
Yeah, actually, thanks for reminding this. I wanted to inform about this also. Yeah, usually the Anupan what I give is honey, sir, in most of the situations, because that is thick enough so that it will stay in the tongue. Because many a times in pediatric and geriatric age group, even if we ask them to keep it under tongue or keep it in the mouth, immediately they will drink water. So we want the medicine to act in that area for some time. And one interesting observation which I forgot to share is many a times I've seen some Vaidyas have started preparing Potlin capsule and distributing. Actually, I forgot to put that one video where a patient with lung CA with brain mets, he had seizure. So, and with that seizure, he was admitted in a modern medicine hospital, my friend's hospital, where even after giving centrally sedating drugs like midazolam, etc., the seizure they were not able to control. And at the same time, even from I was out of station, I had asked them to put a rails tube. And with rails tube, I had asked them to start Hem and Abragarbha Potli with rails tube to control this seizure, which is because of the metastatic disease in the brain. And we wanted to do Nasya also, but I wanted to try whether he's responding to this Potli Kalpas. And he was getting seizure every 15 minutes. It was continuously happening for a period of 28 hours, for 2 days, for 48 hours. And I had given Pottalikalpas through rails tube. And I was surprised, even after giving half gram of Hemagarba and Abragarba, the seizure continued to happen. Even they had given serenase, etc. from modern medicine, what is required to stop seizure. IV preparation, surprisingly, even then it did not work out. And we could not think of giving it orally because the patient will have spasm during seizure. If he accidentally bites the finger, it will be very much harmful for the caregiver. So then once I came back from a camp, I was out of station. Once I came to Bangalore, then I called the caregivers. I asked one person to open the job, one person to open the jaw down. I wore three, four gloves for safety, and I gave the same medicine into the oral cavity. And within 15 minutes, and we know that during seizure episode, the patient will have confusion. We say it as post-ictal confusion. They'll not be able to recognize the surrounding family members, etc. And during seizure episode, he was gone. He was got from home to hospital, and he doesn't remember that he has even come to the hospital, and he was not aware of the people surrounding him. And I was surprised to see, I have the video of that. I did not put it in the presentation, where after administering within 15 minutes, he came back to his consciousness, and for the next 8 hours, he never got seizure. So this actually opened a new experience that Pottalikalpas, I should not make an experiment giving a rails tube or giving in capsule form. Because as of now, sir, I feel to use this Pottalikalpas, we need that platform for what these medicines are, to say how it works, how it does not work. That experience also is very important along with Shastra, I feel. So, and I feel I suggested many people to not do that in capsule form, etc., based on this experience. Where I feel, sir, the sublingual absorption is very much required if it goes directly through rice tube. And many a times, why I'm telling this is because of two reasons. One thing is we should stop using it in capsule form. And secondly, if we are not able to give it through orally, in case of intubation, where the ventilator is put up, we cannot give it sublingually, sir. Only SS is through rails tube. Instead of giving Pottalikalpas, we can give like Jayamangala, Siddhamakarada through rails tube, which will work. Giving Pottalikalpas through that SS is not going to help because unnecessary we should not burden the patient once we know that it does not work through rails tube. So these are some interesting observations, and I feel to make the best use of this medicine, we need the platform. So we are creating the platform, and soon we are going to train Vaidyas with this approach of internship for 3 to 6 months. We are now preparing the modules where they are trained how to handle emergency conditions and even oncology, the approach, how it should be there. We are slowly formulating the modules.
Okay, great, sir. Thank you for sharing this experience because I do believe that in Ayurveda, this Pottalikalpas have been made into a porter, that is Bandha form. And
Yes.
as you rightly said, that if the Bandha is maybe we do not see that effectiveness of that Pottali coming in. One last question, sir, and then we can end this session. Is with regards to the CA rectum we are seeing or colon in that matter. Many a times the patient have been diagnosed at the later stage where there is gradual weight loss. The patient is not known why the weight loss is going on, and by the time we come to know it has meds and all. So in such a cases, how would we approach? And last thing would be is what would you like to advise today to the forum of Ayurveda doctors who are sitting over here with regards to this integrative approach of Ayurveda and allopathy?
Yeah. So, what if answering the first question, sir, regarding you had said about, can you please repeat, sir? I'm not able to exactly.
With regards to CA rectum,
CA
or
rectum.
yes, sir.
Yes, sir. So usually, sir, as you rightly mentioned, sometimes it will be a metastatic disease on presentation.
Hmm.
And for example, even for example, CA colon, there can be liver mets. And even some malignancies like ovarian CA, etc. Even if there is liver mets, still the patient is in an operable condition. If there is no adhesion, we can remove the ovaries, uterus ovaries, and remove the one part of the liver also. Similar applies to colon CA also. If there is no adhesion to the surrounding areas in the area of primary tumor like colon, and it has spread to liver, even then we can remove the part of the sigmoid colon or ascending or descending colon, right hemicolectomy, left hemicolectomy, for example, and remove the metastatic disease also. But at the same time, we are very much benefited. Surgeons will be very much benefited if we are able to reduce the mass of the tumor. And thanks for reminding through this case, sir. I would like to share a case experience where the patient, when he came initially, he had just bleeding per rectum and he was almost going into obstruction. He was passing motion like a paste. So he had distension of abdomen. So, and before operating him, I wanted to buy some time to shrink the tumor so the surgical clearance is much better. So in that case, I had given Tamra Garbha Pottali along with Hartala, Shuddha Manashila. We have planned yoga basti for the patient. and 2 days of Anuvasana, Yoga Basti, Niroha Basti, etc. for 8 sessions. And with every medicine what we give, either Anuvasana or Niroha Basti, I had added high dose of this Pottalikalpas and Basmas. And surprisingly, sir, after third day of completing this treatment, the patient told me that he passed hard material during motion. It is nothing but the tumor which just scraped up and fell from the primary area. And after that, we are able to correlate his passing motion very much normal like others. This is an interesting observation where we are able to give the local action. It will be through Basti for the colorectal cases, sir. We can include this Pottalikalpas in Basti also, along with other Basmas, which is actually depending on the type of tumor. We'll get to know the aggressiveness of the tumor. Accordingly, we plan the dose, the combination, what to be given. So I think in that way, it will be very helpful for colorectal malignancies also, where either the people have access through Basti. Administering along with Basti also will be a very good option, sir.
Okay. Sir, what details that today you have given, I don't think that it is nothing less than an Ayurved physician talking rather than an allopathic physician. And thank you so much, sir, for your precious time. I can understand of the busy schedule of OPD, IPD, your own hospital that you're looking after, that you have taken out time. There are, sir, a few other questions that we would be just with your time. We would like to share it on email. You can answer it so that we can share it to all our audience who are sitting over there. And once again, from Sri Dhootapapeshwar Limited, we thank you for your time that you have spent, your experience that you have shared. And certainly, our audience would like to hear you more. So maybe some other time with some definitive references. Maybe we will take not so much amount of oncology, but some definitive such critical cases. And we will like to have another session with you with your due permission, sir.
Definitely, sir. Thank you, sir. Thank
Okay.
you for the opportunity, and thanks to all the Vaidyas for attending the session and giving their valuable insights. Thank you very much.
Yes.